Speech and language impairment. Presented by Group 1. What is speech and language impairment? Speech or language impairment means a communication disorder, such as stuttering, impaired articulation, a language impairment, or a voice impairment that adversely affects a child's educational performance. In layman terms, it means
Speech and language impairments are two separate but similar disabilities. Speech impairment involves difficulty with producing speech sounds. A person with a speech impairment might distort the sounds of some words or leave other words out completely. This can interfere with communication because it's frustrating for the speaker and distracting to the listener. There are three categories of speech impairment. You have articulation. This is when speech sounds are produced incorrectly, and it includes substitution, which is when one sound is replaced with another. For example, a child might say wabbit instead of rabbit. Omission, which is when a child leaves out a sound in words. For example, they may say abbot instead of rabbit. Distortion is when a child says a sound in an unfamiliar way. This is common in a child who has a lisp. Finally, addition is when a child adds a sound where it does not belong. For example, a child may say slide instead of slide. Then you have fluency, which is difficulties with rhythm and flow of speech. It's characterized by hesitations, repetitions, or prolonged sounds, syllables, words, or phrases. A common example of fluency impairment is stuttering. Finally, we have voice. A person with a voice impairment has an abnormal quality to its pitch, resonance, or loudness. For some, it may be hoarse, raspy, harsh, or sound nasally. Then, a language impairment is a difficulty in understanding or using words in context. A child may have a expressive language disorder, which is where the child has difficulty in expressing ideas or needs, or a receptive language disorder, which is difficulty in understanding what others are saying. Or they may have a mixed language disorder, which is a combination of both an expressive and a receptive language disorder. There are five categories of language impairment. You have morphological, which involves difficulties in understanding structural changes in words, such as word tense, or phonological, which is difficulties in organizing speech patterns and sound contrasts. Pragmatic involves difficulties with understanding the meanings of words and using proper language in social contexts. Syntactic, which is difficulties to understanding and using correct grammar. And finally, semantic involves difficulties understanding word meaning and vocabulary development.
So, let's talk about three common speech and language disorders and how we can accommodate them in our school spaces. The first one is called apraxia of speech, otherwise known as AOS or dyspraxia. This is a speech disorder in which the person has trouble verbalizing what they're trying to say. The brain knows what it wants to say, and our students might even be able to write out what it is that's on their mind. However, there's a weakened speech muscle that is preventing them from verbalizing their thoughts. There's a few things that we can do to accommodate our students with AOS in our classrooms. We can give lots of opportunities for speech and vocabulary games. We should be giving them extra time. We can seat our students strategically with other students who may be able to help them. And most importantly, we can create opportunities to collaborate and build friendships. This particular disability, as well as other disabilities that involve speech and language disorders, can leave students vulnerable to bullying, so it's very important that we're setting them up socially. Stuttering or stammering is another common speech and language impairment. It's a speech disorder that involves the repetition, prolonging, or blockage of words and syllables. This can have a tremendous effect on students academically and socially. There's many things, again, that we can do to accommodate our students who stutter. The most important thing is for us to model good communication by giving appropriate wait time, not filling in words for them, keeping eye contact, and letting them finish speaking. Sometimes it might be tempting for a student who might be struggling with a stutter to fill in words for them, but that's actually the opposite of what we should be doing. We want to avoid comments like slow down. If we have oral presentations in our class, we might choose to allow our students who stutter to choose when they go. Maybe they're first, maybe they're last, in the middle. We can give them ample opportunities to practice their oral presentation. And we might even consider offering them alternative audience sizes, like doing a small group presentation during lunch or even a private presentation. If for some reason you need to address this with your class, maybe students are laughing and it needs to be brought up and a conversation needs to be had, you always want to make sure that you discuss this with the student first. The student may not be comfortable with that, and you want to make sure that you are having that conversation with them. A third common speech and language disorder is dysarthria, which is a speech disorder that is caused by muscle weakness and affects speech, often making it difficult for others to understand what one is saying. To accommodate our students with dysarthria, we want to do a lot of the same things that we're already doing for our other students with speech and language impairments. For these students, we might consider allowing them other ways of communicating. A student with dysarthria might have a really hard time saying things clearly. So we might allow them to write or draw a response. With all of our students, we should be discussing with the student's speech therapist. And for students with dysarthria, we want to make sure that we're checking in about what communication strategies work best for this student. Again, we don't want to correct this student's speech and allow them the time to talk and not finish sentences for them.
Okay, next up is prevalence. All right, so 20% of students between the ages of 3 and 21 with identified disabilities are receiving services for speech and language disorders. Now, 1.5% of school age children were identified as having a speech or language impairment. It's over 1 million. And it also is the largest special education category. Now, these are some warning signs to look out for. What we have is poor reception language skills, limited excessive language skills, limited development in the sound structure of language, as well as non speech indicators such as very few gestures, little imitation, or symbolic play. Now, some more to look out for is incorrect use of words and their meanings, inability to express ideas, limited vocabulary, inability to follow instructions, and inappropriate grammatical patterns.
Warning signs of speech and language disorder can often be confused with autism spectrum disorder and other learning disabilities. So, a careful evaluation by a speech and language pathologist is crucial. Most, if not all, students with a speech or language impairment will need speech language pathology services. There tends to be an over-identification of culturally and linguistically diverse populations within the population of students with speech and language disorders. This happens when a mismatch is observed and incorrectly interpreted between a language used in a particular community and that of the majority culture. Children with speech and language disorders are at special risk for developing behavioral problems. A 2003 study found that 32 out of the 94 children studied between the ages of 4 and 6 years old with language development disorders showed behavioral problems within the clinical range. That is 34% of the children studied, whereas only 6% or 6 of the control subjects had scores in this range. Of the multiple reasons cited by the study, one was that serious emotional problems flow from the children's inability to express themselves or to comprehend others appropriately. As language skills play a key role in socializing, this may be difficult for children with language disorders.
Tips and techniques, strategies for parents and teachers. Parent based interventions. Parental engagement when sharing books with children, such as using the books to enhance print awareness, phonological awareness, and letter acknowledgement, have shown promising results for children with speech language impairment. This approach, in which the parent is taught to bring their child's attention to print on storybooks, with print features such as speech bubbles and large print, draws the child's attention to specific words and letters. This instructional technique, parent based intervention, especially within the child's home context, has numerous advantages such as social validity, feasibility, and efficiency.
All right, so my tip is to encourage and accept all forms of communication. So, learners with speech and language difficulties are often lacking in confidence and shy about speaking in public. So, avoid asking them to repeat mispronounced words or finish their sentences. It's actually better to model the correct form in your response. So, concentrate on the message that they're trying to communicate rather than the grammar. Also, allow alternative ways of communication like gestures, writing, or drawing.
One teaching strategy is known as instructional language modification. These are techniques that will help students with language impairments cope with the daily language demands of school. Research found that teachers trained to adopt these strategies can help improve written expression and listening comprehension of students with language disorders. These strategies include the teacher's written language, teacher's oral language, helping students with information processing, and vocabulary instruction. With teacher's written language, a couple of examples you have teacher can modify the language used on worksheets by breaking down large amounts of information into smaller, visually distinct sections and adding graphics and visual icons to break up the words. Or they can put questions on the same page as the text for easy reference for the students. In teacher's oral language, a teacher can ensure that instructions are explicit rather than inferred, or allow time for students to process and verbally respond to any questions. They should repeat and rephrase key information and instructions in an understandable language to ensure student comprehension, and face the class when giving important instructions. Sometimes that visual connection between the students and the teacher helps. To help students with their information processing, a teacher can get the whole class involved in deconstructing complex texts. For example, creating a mind map for to break down key information. Or they provide a visual planner on the board that outlines the sequence of tasks that's going to be covered in the upcoming lesson. Finally, for vocabulary instruction, teachers can choose a list of keywords that are necessary to the understanding of the lesson of the given topic and teach them directly to the class. They can also embed vocabulary in activities such as creating visual symbols to assist with word meaning and retention. Finally, conducting a whole class interactive activities that break vocabulary words into root words, prefixes, and suffixes for better understanding of the word.
As educators, we need to make sure that we ourselves are fully educated about our individual students' disabilities. Speech and language disorders cover a wide range. It's important that educators are aware of what each specific disability means and how it may impact our students' communication in the classroom. With this knowledge, we can make appropriate individual accommodations, and we can learn more information about each specific student's learning needs and disability by reading our students' IEPs carefully and closely. Another tip is to model good communication. We already covered some of these points in the three common different types of speech and language impairments. First, we should be using proper wait time. This is something that will help our students with disabilities, but also all of our students. Students may just need a little bit more time in order to communicate, so we need to ensure that we're giving it to them. Even if it feels awkward to sit there in silence, I promise it's worth it. We should be listening and being patient. Sometimes it might be tempting to fill in words for them when there's silence, but we should not be speaking for our students with speech and language impairments or filling in words for them. Finally, we need to make sure that we're constantly communicating with their speech and language pathologists to stay up to date on how communication is going with our students.
Alright, so use of personal amplification devices. better known as just a speaker. These devices help uh, not only students who are hard of hearing, but also students who hear more clearly. So this helps you amplify your voice if you might be a low-spoken teacher or somebody who needs to speak up. You're often funded by school administration, so a lot of times you can talk to your administration and they will help either pay for some of it, pay for half of it, whatever. And they're usually very supportive when you have these kind of wants or needs for your classroom. Some other important facts about speech and language impairment. So, a lot of this comes from the American Hearing and Speech Society. Apparently, around two-thirds out of every 1,000 children exhibit some form of hearing loss. More than 90% of children with hearing issues are born to fully hearing parents. Males are more likely to experience hearing loss. So that's kind of interesting. About 13% of children have hearing loss in both ears. That number gets lower for students or for children that have hearing loss in only one ear, actually. It's a little less common. In 2019, around 110 cochlear implants were implanted into children to aid in hearing, and almost 5 out of every 6 children in the United States experience some kind of form of ear infection. Sometimes goes untreated or unnoticed, which could cause some hearing issues or damage to any hearing the child may have. ASL and other signs and sign languages. ASL is American Sign Language. It's also considered a foreign language because it comes from France, actually. Children acquire ASL the same way they acquire spoken language. So their parents learn ASL, they teach the child ASL, and that's kind of how they develop signing. ASL is the third most popular language in the United States, English being number one and Spanish being number two. On speech impairment facts, 10% of Americans have a speech impairment. By first grade, 5% of students have speech issues. That's why a lot of times districts will invest in speech teachers or speech pathologists that are on staff. And around 3 million Americans have some form of stutter or impairment in their spoken word.